second to start that. As a little bit of housekeeping, everyone is muted, and that's just to eliminate any potential background noise during the webinar. You will be able to ask questions through the chat, and then we'll leave some time at the end for questions as well. So feel free to chat during or hold your question for the end. Nicole, I imagine you have a title slide if you want to advance to that. So Nicole Berning is with us today to present on early intensive developmental and behavioral intervention, EIDBI. Nicole is a clinical lead with the Minnesota Department of Human Services. Nicole Berning is a board certified behavior analyst, and she works with DHS in the Disability Services Division as the Autism Clinical Lead for the EIDBI benefit. Nicole is a board certified behavior analyst with a background in providing early intensive behavioral intervention services to children with autism spectrum disorder and related conditions. Nicole currently provides consultation and technical assistance training to early intervention providers across the state on EIDBI policies and procedures. She also provides training to parents and caregivers of children with autism spectrum disorder and related conditions on the services and supports available and how to access them. Nicole's personal interest in this topic stems from her years of clinical experience working with families that were challenged to access early intervention services. Nicole, thank you so much for joining us.
Thank you, Jamie. I appreciate you having me, and I appreciate everybody on the line today. I know everyone has a lot of competing demands going on right now, and our home life and our work life is looking a little bit different. So I really appreciate you all taking the time today and participate in the webinar. So hopefully you'll find some helpful resources and some strategies. First, I'm going to go over the Early Intensive Developmental and Behavioral Intervention Benefit, or EIDBI, and then share some new resources that we've recently created through the different Minnesota state agencies to help families navigate the system, because it is very complicated. There's a lot of resources out there, but it can be challenging to know how to access them or to know which resource is right for you and your family. And then lastly, we're going to go through some different strategies and resources that will hopefully be able to help you as you're navigating either therapy or school, working from home, all those different things right now during this peacetime emergency that will hopefully help to make that transition a little bit easier for everyone. So to start off with EIDBI, we like to kind of break down that acronym. It's a pretty long title. So really the EIDBI benefit was created and its intention is to target early screening, diagnosis, and treatment for children. So we're really trying to see that, right now that average age is around 5 years old for children, really trying to move that down so that we are seeing children get the proper screening, get an accurate diagnosis, and get access to the right treatment that will help them meet their best outcomes. And then the next component is really the intensive component of EIDBI. So right now there's a minimum of 10 hours per week that's required in accessing the benefit, and anywhere up to an average of 40 hours a week, really based on the medical necessity for each individual child, whatever best meets their needs. But it is intended to be a fairly intensive support for families and for the child. So not necessarily a long-term support, but something that the child can access and really have some intensive medical services for a while in order to help them build on their skills, help them increase communication, increase those independent life skills, self-care skills, things like that. All of the treatment methods that are incorporated into EIDBI are evidence-based treatment methods, and we'll go through what some of those are here in the next few slides. And then all of the intervention is considered a medical treatment provided one-on-one between a therapist and the child, or in a small group of other children that are also receiving EIDBI services. So just brief background, EIDBI is still fairly new. So it was originally passed into law in 2013 is when it was created. And over the years, we have done a lot of work in adding some different amendments and working on the laws to hopefully expand services to additional providers, which then increases access to families across Minnesota. So just really trying to take feedback from individuals that are accessing the benefit, providers who are providing the service, and being able to modify things and make it easier. So we are always taking in feedback from stakeholders. One way is that we do currently have an EIDBI advisory group that is made up of stakeholders, of adults with autism, families, caregivers, professionals in the field, and a number of different providers, county caseworkers, things like that, that continue to offer their input, and we see the benefit continue to evolve over time. So really the purpose is to increase the child's social interaction skills, target those core deficits of autism, incorporate that functional communication, building on the child's independence, hopefully, making them to live as independently as possible, participate within the community, participate in their families' activities. And we really try to incorporate all of those person-centered, family-centered practices. So you'll see throughout a lot of the different treatment plans and services that it's really about, what is going to best help this family or this child. So what are the goals that would make the most difference for them and their family? Not necessarily just a cookie cutter treatment approach across children, but really trying to make sure that the provider is really targeting things that will make the biggest difference and the biggest impact with that child and that family. So eligibility for EIDBI, it is a birth up to age 21 program, and with the diagnosis of autism or a related condition, which we'll talk about a little bit in the next slide. And then also completing what we call a comprehensive multidisciplinary evaluation, or a CMDE. And that just helps to establish if the child does meet medical necessity for the service. And that's done by a licensed mental health professional. And then a family, whether they're on Medicaid, including Minnesota Care, MA-TEFRA, a prepaid health plan, some private insurance companies also will cover for EIDBI services, but it really is available and it's open to anyone in Minnesota to be able to access. So some of those related conditions, we define those as anything that is also severe and chronic, similar symptoms. So again, some of those deficits in social interaction and communication. And we would also just look to see if this type of treatment that is offered through EIDBI is appropriate for that child and their condition. So this list is just meant to be, give some examples. It's certainly not an exhaustive list. There are other conditions also that EIDBI providers will also serve. So things like attention deficit hyperactivity disorder, reactive attachment disorder, fetal alcohol syndrome. So things like that can also be covered in under the EIDBI benefit. And through that comprehensive evaluation, that can include information from a lot of different providers. It includes a medical evaluation. It includes any other types of services and supports the child may be accessing. So if they've seen an occupational therapist or someone like that, it incorporates all of that information. That's really a part of that multidisciplinary approach there, that it is inclusive of all of that, that different information. And it can also be used as a diagnostic assessment. So many other services and supports ask for a diagnostic assessment to be completed. So this document does also meet those requirements as well. So it could be used in order to access things like speech therapy or occupational therapy or psychotherapy or other different services the child may need. And we do have a link to the form in the document. And as Jamie said, all of the slides will be sent out, so you'll be able to access those and take a look if you're interested in that. But it is a standard document that all providers fill out, all families will complete with their child. Other covered services, in addition to the CMDE, include an individualized treatment plan. Again, it's a standard document that all children complete, and we have the link to that. And then there is also the intervention component, which can be provided in that individual one-on-one setting or with the group. In addition, EIDBI also covers for family caregiver training and counseling. And this service really helps to train families on the skills and the different strategies of working with their child, so they can be much like the therapists that are working with the child one-on-one as well. And this service can also be provided individually or with a group of other parents and families. So it can be very nice to also set up, group training from your provider, hear from other parents about what's working for them, what's not working, those types of things. So a variety of different options of learning opportunities there. We also reimburse for observation and direction, which is providing some additional training and allowing a higher level professional in order to give some feedback and some additional guidance to professionals that may not have as much education or experience. And we think this is really a valuable service that EIDBI offers in order to continue to see providers gain education, gain experience, gain more skills, more training in the field. And we know that staff that feel that they're well trained and able to navigate through any situation that comes up, and they feel very competent in their role, they also stay on and are staff that are retained with the organization longer. They stay in the field longer, all of those types of things, which ultimately is a benefit to the child and family. So we think that that's a unique and really valuable service that EIDBI covers. We also reimburse for a coordinated care conference that allows a lot of the different professionals in the child's life, so whether it be a speech therapist or a school provider if they're going to school, the special education teacher, those types of individuals, to meet with the EIDBI providers and really coordinate all of those services. And of course the families involved, and they're listening and giving their input as well on what goals and what types of things are a priority for all the providers to incorporate together. So some of those evidence-based practices I mentioned that are required of all the providers implementing EIDBI, we do offer both behavioral and developmental approaches. So some of those include applied behavior analysis, the developmental individual difference relationship-based model, or the DIR floor time, the early start Denver model, the play project, and the relation development intervention, or RDI. So there's a number of different treatment methods and approaches. It really depends on that individual provider to see which type of service that they offer. And it's always qualified providers. They have to enroll with Department of Human Services, and they have to give us some background on their education and their level of experience in order to enroll. So it kind of is giving you that peace of mind as a family member to know that the individuals working with your child, really do have some credentials and have some experience to back up the work that they're doing. And EIDBI can be coordinated with other services the child is receiving. So it doesn't mean that they have to stop going to see that speech therapist or stop going to the OT. They can access mental health services, including crisis, respite, psychotherapy. They can maintain having, case management services. They can be going to school and also accessing EIDBI. So that's not something it's restricted or anything along those lines. EIDBI is not a waiver program. It is a state plan service, so it is not required that the child be on a waiver, but it's also not prohibited. So if they have a waiver, that they can also be accessing EIDBI as well. And EIDBI is offered in a variety of settings. So some providers you'll see will have a center-based intervention, or other providers are going out to the home directly and providing the services right there. We also will reimburse for working on skills within the community, which we know is so important. Helping families to be able to go out to eat as a family and manage some of those behaviors, and being able to go to Target and things like that. So really being able to take the providers and the child into that community setting and work on those skills and generalize them into a variety of different settings. The child can also have the provider, the EIDBI provider, in school with them. So this is in addition to anything on the IEP. It would not impact their IEP in any way. This is just something that they can maintain and have some additional services and supports within the school, and really helping to see that transition occur. We do also have telemedicine reimbursement for a number of different EIDBI services, which has been really critical, especially during this time, for providers to still be able to maintain therapy with the child at this time. But in all cases, it's a helpful service. A lot of the evaluation, the treatment plan, a lot of those things, that observation and direction, or any of the family caregiver training and counseling component can be delivered via telemedicine. And that can really just help to make those services a little more efficient. It can help families that live in rural communities access this service if there are not providers nearby. So we really also see that as a valuable component to EIDBI services. That programming in school, we do emphasize that it's not intended to be a long-term support in the school, but to see it more as a transition service. So transitioning from an early intervention into the school district, hopefully then the child is, adapting to the supports that the school can offer. Or it might be where the EIDBI provider is called in to help provide some training to the school staff, or to provide some consultation on some behaviors that are occurring within the school, those types of things. So it can be used for a variety of different things within the school programming. And we do offer a number of different trainings, both to providers of EIDBI, and we also have resources for families that would like more information. So we have the link there to the EIDBI 101 training. So for the providers, it goes into a little more detail on how do you enroll as a provider, what are the qualifications, those types of things. For families, it goes into how do you find a provider, what other services and supports might also be helpful to your family to access, and just really goes into a lot of detail about what you can expect from EIDBI services. So they're a great resource. They're online, available all the time, so you can watch them on your computer, iPad, tablet, phone, anything like that. So a great resource for both providers and families. We also have a cultural responsiveness training that we require all EIDBI providers to take, and it goes into a lot of background on what being culturally responsive means, how to have effective communication with a diverse set of families and caregivers, working with interpreters. It gives some different suggestions for that, and just really some helpful strategies and just things that providers can implement throughout their practice and that hopefully will set them up for more success in working with a large variety of different families across Minnesota. Just some pictures of what EIDBI services look like. So these are kiddos that are actually receiving the benefit and accessing the different services. So as you can see, these are all from in-home sessions, but as I said, it's also a center-based service as well, but you'll see that intensive component of having the therapist there with the child and working on some of those skills within the home. We do offer the EIDBI brochure in a number of different languages. We have all of the links to that. And this is just a diagram of the agency structure. So within each provider agency, they're required to have that qualified supervising professional or that licensed mental health professional to kind of oversee and supervise all of the different services. And then that evaluation provider. And then you'll see the different direct care staff are broken up into level 1, level 2, and level 3 staff. And for each of them, that level 1 is typically around a master's degree level provider, has quite a bit of experience, quite a bit of background, likely some additional certifications in the different treatment modalities. That level 2 provider is more at that bachelor's level degree and a little less experience required. They're likely receiving some additional trainings and supports from providers through that observation and direction. And then the level 3 staff are required to have a high school diploma or GED, be at least 18 years old, and just have 1 year of experience. So those staff would again be getting some additional training and supports and continuing to gain skills as they continue their work. And right now across the state we have 70 EIDBI provider agencies, and there are 102 individual providers that will implement that comprehensive multidisciplinary evaluation. And so far, just this year, 962 recipients have received EIDBI services, and we continue to see that number grow quite rapidly. So additional people are accessing and being able to access these different supports. So this is just a heat map of where some of the recipients are located. So you can see when it's a bit of a darker color, there's more recipients there. The lighter colors, obviously less recipients, but as you can see, we're not everywhere across the state, but we are certainly expanding. So children are increasing access out to those rural areas as well. So we're always happy to see that. And then I just included the EIDBI provider directory. So if you would like to see if there's a provider in your area, I will suggest also that the minnesotahelp.info does go into a little more detail about what counties an individual provider will serve, what insurance they will take, those types of things. So using both of those directories can be helpful in order to find a provider in your area. I did also want to just mention my colleague, Kim Hicks, that I work with on the EIDBI benefit, had done a previous webinar for Family Voices as well, and that went over a lot of the different medical coverage options in Minnesota. So if you do have any questions or need to connect to some of those healthcare resources before accessing something like EIDBI, that could be a really helpful resource for you to also access that webinar on demand there. So next, I was just going to move into some of those different resources that we've created. So with a number of different state agencies. So in addition to DHS, we've worked with Department of Health and Department of Education and the Department of Employment and Economic Development, really to try and incorporate the supports that a family is accessing for their child throughout their lifespan, throughout a variety of different settings. Because what we often hear is, unfortunately, a child is is given access to certain supports, either, maybe it's through their doctor, or when they get into school, they're getting some resources, or they may have heard about a community-based provider, but they're not often able to access those supports across the different agencies or across those different settings. So we would really like to try and break down those silos that children are often put into right now, and really encourage providers to work as a multidisciplinary team, and to make some of those services work a little more seamlessly across the different agencies. So one resource that we've created in order to help families kind of navigate and see what's available to them is what we're called the Pathway to Services and Supports for Children with Autism Spectrum Disorders. And it does break down those services through healthcare, education, those through Department of Human Services, and some of those more transition and long-term services and supports. You'll also see in the box there, it does list out things that are available through a waiver or that require a mid-choice assessment that's done by your county or tribal agency. And those can be just some additional services and supports. So just to kind of see what's available, what may your child be already accessing, where might there be some gaps, and what additional resources could you be accessing, and to really emphasize that even if the child is accessing occupational therapy, for example, through their healthcare provider, that they could also be accessing some additional supports and services, whether that be another OT session from the school, or whether they're also going to an EIDBI provider as well. So to just really see that these things can work together and can be accessed. So then we also include some resources down at the bottom of the form of where families can kind of start to locate these different resources and check for eligibility. So we have the Minnesota Autism Resource Portal, which I'll be going through in a little more detail in a few slides here. And we always have what we call the ASD email inbox, and that's asd.dhs@state.mn.us. And that's really used for any question of any person with autism, anybody that just has any autism related question whatsoever. You can send it to that inbox, and we will filter it out to who can answer that question if we're not able to on our team here at DHS. So that's a great resource. Another great resource is the Disability Hub of Minnesota. They can always help answer your questions, or if you're getting stuck, you're trying to call the county and maybe not hearing back, or you sent in for a disability determination and you're waiting to hear and haven't heard a status update. That Disability Hub can be a great resource to help kind of facilitate three-way calls, or to check on the status of any of your eligibility requirements and things like that. So another great resource, trying to get all of them onto one document for everyone. The back of the form just has the different symptoms and what the diagnosis components are of autism, and really trying to help explain that difference between the educational determination and a medical diagnosis. So I know that can be a little bit confusing for families that have that determination through school, the child's accessing supports, but then wonder, why do I have to go through additional testing, additional supports in order to have my child access medical assistance, for instance, or to be able to go see an additional provider. It is clear that a lot of those different financial supports, a lot of the different services and supports through DHS are required to have that medical diagnosis component. So just trying to kind of compare and contrast those two together. So as I said, it was created as an interagency team, and includes a lot of helpful resources. And we right now look at this document as having an audience of educators, healthcare providers, social workers, case managers, and other professionals in order to sit down with the family and really go through the document together. It is a little overwhelming. It's a lot of different resources. So we do recommend having someone that has a bit of that navigation, case management background to help a family kind of walk through it together. It is available to print and to distribute or send out via email. So I have the link included there. We are also working on a parent and caregiver version as well. And we are getting ready to launch the form into different translated languages also. And if you're a family member and you have gone through these different kind of systems of supports through the state and you've accessed financial assistance or any of those types of components and would like to give us your feedback and really shape how that document for families is created, we would really appreciate if you can take some time just to give us your input on navigating the system and what worked well for you, what did not work well, those types of things. So we're doing this in conjunction with Wilder Research, and they're conducting interviews with families. So if you're interested, I have the information available there that you can contact them, and you will receive a $30 gift card for your time in participating in that interview. And then, as I mentioned earlier, the Minnesota Autism Resource Portal is also an interagency resource that we have created and has a lot of these different services and supports all in one place on the website. And one of those resources being the ASD Strategies in Action. That training is broken up into a toddler age, a school age, and a transition age. And it offers up to 40 hours of online training for families. And really anyone, providers, anyone that interacts with the child and could benefit from hearing a bit more on some different strategies of working with their child. So you can always contact us through that ASD email inbox and receive a free subscription. So we really encourage you to share that with any of your networks and be able to access that training. Definitely a valuable resource to share. And these are just some of the different things that you'll see as you navigate through the website. So under basic needs, looking up things like that healthcare coverage, childcare, food and nutrition resources, economic assistance, housing, transportation, all of those different things if you are in need of some other resources and supports. Under the intervention services, this is where you would really be able to go and locate a service provider, find out some additional educational services. How do I get connected with special education services in my district? This would be a good place to start. And looking into any of those transition and employment supports for adults with autism as well. So a lot of different resources, a lot of information, but we hope that it's fairly easy to navigate and look through and find what you need. Under supports, we also have some community and recreation suggestions, support groups, advocacy, and legal organizations available. And we also have a place where if you feel like we're missing something or there's something that you would like to add, that you can submit that to us and we can get it posted up on the website if it meets the criteria, and we would be happy to include that. You'll also see on the website that we include some videos that we created in partnership with the University of Minnesota and the Institute on Community Integration. And these really help families from diverse backgrounds that are going through the diagnosis and trying to access services and supports for the first time. And it includes families that are from Minnesota and have experienced this firsthand, talk about their journey and talk about how they were able to overcome some of the stigma that exists in some of those communities around autism, and how they were able to get connected to resources and supports when it's not always very easy to do so. So it can be really, really helpful resource to share for families to kind of see others that look like them, come from their community as well, talk about their journey. So now to transition and go into some of those different resources and strategies. I know this is a bit of uncharted territory for all of us. I think there can also be a certain comfort level to that, though, that we're all kind of experiencing this temporary new normal together. And so hopefully, I think, just keeping in mind that whether you're trying to transition to schoolwork at home or therapy at home or whatever it may be, that it doesn't have to look perfect. Everyone, I think, is going to be struggling, but we just hope that some of these strategies will help make a little bit of progress every day to make this transition easier. So the 4 essential kind of strategies I'm going to share today include establish a functional routine and a schedule, and then we'll move into increasing opportunities to be moving your body or being outside, utilizing positive feedback, and establishing and maintaining some support networks. So first, and one of the most important strategies right now, is to establish a schedule or a routine for the day. Right now, it's really likely that the child's normal routine and your routine have been disrupted in more ways than one. So trying to establish a new normal as soon as possible will hopefully help to gain back some of that control and some predictability that would really help someone with autism succeed throughout the day. This could be one overall schedule that you use throughout the day, or it might include creating some different routines to help with some specific activities that the child might be struggling with, or that they're having to engage in now that they weren't before, such as hand washing really frequently, or setting up a therapy session via telehealth with their speech pathologist or their early intervention provider. So how do we kind of help to build in those different schedules and routines now? So some of the different components really ensure the schedule stays in line with the natural rhythm of the day. I think it's been a struggle right now just to make sure everyone, if you're not leaving the house, that we're all still kind of getting up and getting dressed and getting going and moving. And then also, getting to bed on time and making sure that they're getting enough activity throughout the day to be able to sleep well through the night. Just setting them up for success, hopefully, with all those activities throughout the day. And trying to incorporate as many of the different, some of the similar activities that the child was already doing day to day before this kind of disruption happened, and how can we kind of adapt them and help them still access some of those activities now. A timer can also be a really helpful strategy to help transition between the different components on the schedule. So whether or not you have one, set that up on your phone or set it up on the stove, just letting them have that timer to help alert them that they need to kind of move on to the next thing. Another idea might be to create a calendar to have some events to look forward to. So maybe putting things on there like we're going to FaceTime with grandma or have a game night with the family. So just some different activities that can kind of replace some of those that the child may have been used to or may have been expecting to go to, kind of replace some of those and have that ability to look forward to it. We also just recommend those first then statements or picture cards. So these can be really helpful, especially tackling some of those less preferred tasks and activities that they're having to experience. So really using that visual support. And we have a link here where there's an example of an app that you can put on your phone for a first then visual schedule. Or it can be as simple as just putting it on a piece of paper and having that available. So you could draw in the picture or draw in the different reward that they're working towards, or you can even put the object itself in the boxes. And I did include the link to all of these different kind of templates and ideas here at the end, so you can print them off and be using them as a resource as well. as part of that schedule to just keep in mind to really communicate to the child what they should be doing right now, rather than a lot of corrective action. So again, this is, uncertain, it's a challenging time for all of us, but they're just really unsure, how am I supposed to be filling my day right now? What am I supposed to be doing? So the more that we can really communicate to them how to fill their time with appropriate activities and make them successful ahead of time and be proactive, setting them up for success. And if you can really be modeling those expectations for them, or get siblings involved to have them help model some of the new activities that are going on. If they kind of see everyone is doing this, they're more likely to just kind of get on board with it and get going. Offering choices, also helping them to feel like they're gaining back some of that control, where they may feel that, I'm not sure what's going on, I'm not sure what's happening, or why I can't, go to school like I'm used to. So bringing back some of those choices, whether it be as simple as, which puzzle do you want to do right now? Or do you want to, read this book or this one right now? That just kind of giving them some input on the schedule throughout the day. And another component that can really help bring some structure back is to set up a designated area for learning. So as part of that routine, having an area where, now the child knows that this isn't really my play area, this isn't where, we're eating, but this is really where, we might be engaging in schoolwork now, or we might be having our therapy session, but have it kind of be a place that they go to every day for that, just kind of bringing them back some of that structure again, and thinking about helping to prepare the materials ahead of time, making it free of as many distractions as you can, but also just making it really fun, having them help you create some decorations for that area, just do some of those things. This is a great place to put up that schedule and have, maybe a token board if you're going to be using one of those, have that all prepared in this different work area. So just for the sake of time, we won't go into a lot of detail, but just an example of what kind of schedule or routine throughout the day that you could set up. Some of the big things, I think, is just trying to keep that morning routine as normal as possible. So like I said, really, getting up, getting dressed, getting breakfast, trying to even, pack lunches for the day, just so that hopefully helps to cut down on the child asking for snacks throughout the day. And then hopefully once things get really busy and chaotic and you're maybe having to juggle working from home and managing the child being at home, you have some of those things already prepared and ready to go for that activity later on. I also recommend just really trying to spend a few minutes in the morning, having some of that direct one-on-one time, giving the child some undivided attention, really giving them a lot of praise during this time. It would really help to let the child kind of direct this play time, letting them make some choices really before going into more of a structured routine throughout the day, whereas, they might not have as much input, or you might not have as much time to be giving some of that direct one-on-one attention throughout the day. And this can be really helpful to repeat if you have an upcoming work call or a meeting that you really have to have, your attention is going to be divided, that having this free play time ahead of time will hopefully just help the child to feel like they've gotten some of that one-on-one time before. And then for the afternoon time, we really would see, more success in trying to leave some of those more demanding, a bit of the harder tasks for the morning, and then in the afternoon just trying to focus on making some of those learning activities fun, get outside, get moving, some of those things to just help as energy is kind of dwindling and everybody has been busy all day, to just make it a little less demanding in the afternoon. And then setting it up in the dinner evening routine, just trying to involve everyone in the whole family, getting everyone included, giving everyone some different chores and activities to do, which will hopefully leave some time for a fun movie night or just some free time in the evening. Some of the benefits of the schedule, hopefully again, this will bring back some of that predictability for the family, create some new normalcy around this new routine, help to kind of ease into some of these new activities that are a little strange for the child to be having to do now at home, or explain, you know, why we can't be going out as often. And hopefully it just is increasing some of those communication opportunities, you know, encouraging language, encouraging interactions with others throughout the day. So just some different resources. Again, the Autism Helper always has some great visual aids and templates and schedules that you can print off. And creating videos, social stories that can really help to explain some of the things that are going on. And I do have some additional resources and social stories at the end here as well that you can reference. But I think also just, you know, being flexible. If something's not working in the schedule, change it up, and don't feel like, you know, you have to stick to it or you just have to keep trying over and over. So just giving yourself a little grace there to know that you can modify things as you go. And that these visuals and these schedules, they don't have to be anything fancy. They just have to be able to function well for you and your family. So just whatever you can make around the house right now would be really helpful. So the next one is just increasing those opportunities to have the child be moving their body, to get outside. So we know that all children with autism, that sensory output or input can be so critical. So really helping them to find some opportunities to be able to engage in that, present some calming activities, be able to get outdoors. Some of those benefits just hopefully will help increase their focus and their attention, decrease some of those impulsive behaviors, unwanted, challenging behaviors throughout the day. And it's just another great structured activity to add to the schedule. And I did include a resource from the Behavior Change Collective. They have some great guides out right now about some indoor activities that you can do with your child right now. They also have an in-home live gym class that they're offering every day. So if that's, if you need some ideas of what to do, there's a lot of resources out there right now. Really also just keeping in mind, watching for those signs of any challenging behaviors. So if you see the child start to escalate, that you are, you know, directing them to a calm space in the house, decreasing some of the demands, really emphasizing that reward on calm, appropriate behaviors, trying to redirect to a new activity. You know, likely if they see you moving on, they will too. If they see you staying calm throughout this different change and this disruption to the routine, you know, likely they will also be able to reach that calm as well. If you do need some additional supports, you know, definitely don't hesitate to reach out and ask people for help. There's a number of behavioral health providers, case managers out there setting up telehealth appointments online. I also included the Disability Hub again that has a lot of resources out there for families now. The next component, just really focusing on increasing that positive feedback. This will help to hopefully prevent challenging behaviors from occurring. So if you need to, just set a timer to remind yourself to reinforce when they're, you know, engaging in appropriate communication, they're playing well, cooperating with their siblings maybe, or independently playing well on their own. Just really being able to get in there and give some of that attention and praise for those appropriate behaviors, kind of before the opportunity where, you know, now something has happened and you're having to deliver some negative feedback to the child. Using their interests right now, their preferred items, to really help give that reward for some of those less preferred tasks. So I just included a quick resource, so it can help be a quick visual reminder that if you do have to offer any corrective or negative feedback to the child, to really try and look for those positive opportunities. And this will really help from things kind of spiraling and really going down quick when some of those behaviors are starting to occur. So really to change that and get it back onto a positive note. And the last thing is just to really be maintaining your support networks, and if needed, to establish some new support networks. I know this is, hard for us all right now as we're trying to maintain that social distancing, but there are a lot of different resources out there online, or continuing to connect with different members of the community through text or FaceTime or any of those things. Just taking time for self-care, remembering that you're not alone in this. We're all in this together. So there are resources out there. I did just offer the family voices again, and also other support groups and organizations as well that you can definitely reach out to at this time. The Autism Society of Minnesota also has some great resources. I gave some examples of some different podcasts that are available right now and have covered a lot of this. And then, as I mentioned, there's just a lot of different resources from a lot of organizations right now that could be helpful to include. So, and then those links to the different templates that I went over. And then I just included my contact information. So that is all I had for today. Does anyone have any questions for me?
Nicole, we had a question chatted that is asking you to discuss the differences between ABA and EIDBI and whether or not you can receive both services.
Yep, so EIDBI is just the name of the overall benefit, and then ABA is just one of the different treatment options under the EIDBI benefit. So ABA is a type of treatment method within EIDBI. So not kind of an either or, but just one of the different treatment options that the family can be receiving. So if you call an EIDBI provider and you can ask them, what type of treatment method are you using? And, likely, over 90% of providers do offer applied behavior analysis or that ABA approach. And then they could tell you, a lot of providers will also incorporate some of those more developmental treatment methods as well into their practice. So hopefully that helps to clarify.
Yeah, so we have another question in the chat that I'm going to read for just a second, but I wanted to just unmute participants so that people can ask questions. So if everyone could just pay attention to muting your own line so that we can continue to eliminate background noise for the recording. So I'm going to unmute and then I'll ask this question from the chat. Again, if people could mute their lines, that would be helpful. So we have a question in this chat about the difference between CTSS and EIDBI.
Yeah, so CTSS, or the Children's Therapeutic Services and Supports, is another program through Department of Human Services, and that's actually managed out of the Behavioral Health Unit, where we are the Disability Services, and really a lot of the providers might be similar. A lot of our providers are both CTSS and EIDBI providers, but some of the covered services are a bit different for CTSS. So they cover more of like the psychotherapy approach, more of kind of the mental health services. Under EIDBI, there are skills training, day treatment, those types of things as well. So in essence, it doesn't often look a lot different for a parent who might say, well, my provider is a CTSS provider versus EIDBI, but they're just two different funding streams that have a little bit of different covered services, different eligibility criteria, that type of thing. And we would see that it is likely that a child could maintain CTSS services in addition to EIDBI as long as they're not duplicative in nature. So.
Great, thank you. Does anyone else have another question? You can either speak up or you can type it into the chat and I can read it.
This is Terry. I have a question. Can you hear me?
Yeah.
Yep,
Okay.
I can hear you. Go ahead.
So I just want to clarify a little bit on what you said before. So the therapist themselves does not have to be EIDBI certified, quote unquote. EIDBI is the funding stream.
Correct.
So if they're, but
Yep.
if the child qualifies for EIDBI, then that skills worker just needs to follow that program, those goals, I guess, that would be specific towards EIDBI.
Yes, so the provider would likely be trained in one of those different treatment approaches. So they may have a background in applied behavior analysis, or they may be trained in the PLAY project, or one of those different treatment methods as an individual provider. And they're getting reimbursement through the EIDBI program at DHS, and they're following all of the policies and procedures that live and kind of exist under the EIDBI law statute.
Oh, okay, so they just need to be trained in one of those ABA or those other RDI programs.
Correct. Yeah.
Okay, perfect. Thank you.
So I'm just aware of the time, and we will send out these slides and a link to this recording, and you will have Nicole's information if you have follow-up questions. I will also send out a link to a survey, and that just gives us information on whether at Family Voices we're providing information that is relevant and useful for families, and we're always trying to improve. So we really appreciate you just taking a few minutes for that feedback. And we, again, are here to support families. Our hearts are with everyone right now, as I know we have some really challenging times, and we take a lot of solace in staying connected in every way that we can. Nicole, thank you so much for putting this together and for helping families and children. We appreciate it.
Great, thank you. Thanks for having me.
Great, have a good one.